in which we will summarize the remaining topics which I have not covered in those 100 expected questions. And in this way, I will try to completely give you a clear idea that what are the area from which question will come. So let's have this new question which has been asked but not been discussed much, so kind of new, that which of the following is not a demographic process? So demographic process are 5 things. They are social mobility, marriage, migration, mortality, and birth. These 5 are known as demographic process. Natural selection is not a demographic process. Natural selection lead to drift or shift. It lead to genetic drift. And drift occur in influenza type B and type C. And it will lead to seasonal influenza. B and C will cause only small epidemic seasonal influenza. Whereas, I hope you know, the shift, genetic shift occur in type A and type B influenza, and A influenza lead to pandemic every 7 to 10 years. That is why if they ask, what is the most common type of influenza? So influenza type A, which cause pandemic, is the most common. And why does shift occur? Shift occur due to frame shift mutation. The complete recombination or reassortment of gene is shift. Shift is a big thing. Drift is like drifting your car around a girl so that the girl naturally select you. So drifting is due to natural selection, and shifting means you had big accident upside down and your car went to the wrong side, like complete recombination, reassortment of gene. That's why A lead to pandemic and big epidemic. So do remember, shift and drift both occur in B, but shift occur only in type A, and that lead to pandemic. And this is the 5 demographic processes being written here. It is fertility or birth, you can say birth or fertility, then mortality, marriage, migration, and social mobility. These 5 are demographic process. Next question is, which is not true for symposium? So in symposium, 4 to 8 experts speak on a topic in pre-decided order. This is correct. Discussion can occur among expert. This is wrong. If discussion occur in expert, then we will call it as panel discussion. So in panel discussion, people can discuss among each other, the expert can discuss among each other, but not in symposium. Audience can ask question only at end of discussion. This is correct for symposium. In panel discussion, after the initial discussion ended in the expert, then audience can ask question. जब शुरू के विद्वान अपनी विद्वता बोल चुके होंगे, साबित कर चुके होंगे, तब पब्लिक सवाल पूछेगी, और सिंपोजियम में सवाल बिल्कुल आखिरी में पूछा जाएगा. पैनल डिस्कशन में आपस में बातचीत एक्सपर्ट करेंगे, सिंपोजियम में नहीं करेंगे. दोनों में चेयरमैन समरी एट एंड ऑफ सेशन करेगा. इसीलिए बेटर डिस्कशन क्या है? बेटर है पैनल डिस्कशन, क्योंकि पैनल डिस्कशन में एक्सपर्ट कैन डिस्कस विथ ईच अदर. ओके, सो ये चीज आप इसमें भी लिखा हुआ देख सकते हैं, पार्क में भी, कि सिंपोजियम में there is no discussion among the symposium member like in panel discussion. This is the main difference. Second thing, they ask again and again, which is the best way to tell the community how to use WHO ORS, how to use condom, how to use thermometer, pulse oximeter. So all of these is best decided by demonstration, not workshop. Demonstration will be the best way to tell about WHO, ORS, or Sakir tape, thermometer, condom use. Everything is best to tell people by live doing the demonstration. And of course, for condom use, you will not take out your pant and show it to them. And you might have some dildo or something, as a fake thing on which you will show it. And then demonstration will be for these things, but workshop is mainly for ASA training, A&M training. Workshop usually go for 2-3 days, and in the first session we tell them the theory, in the second session we ask them to do the practical. So workshop is for that. Role play, role play is done usually in front of 20-25 people, not in your bedroom. That is the role play we are talking here, not that role play. And in the role play, basically our main work is to tell the people about problems of human relationship, or about common society issue. Like let's say people after snake bite, they go to Baiga Baba, not to hospital and all. So, and they are not following this right strategy which we use for managing a snake bite case, in which I stand for immobility, not in season. So they are giving in season, then they are putting a different powder in it, and all this bad thing they are doing. That is something which you want to teach the people that this is wrong and this is correct. So how can you teach it? By doing a small drama in front of that. That drama is known as role play. Now, one more question area is about focus group discussion. In FGD, first question is, in the focus group discussion, how many people participate? So the people which participate in FGD is 6 to 12 people. They sit in member and then they discuss the issue. Now, they have asked recently that is it active, passive or facilitated? So it is facilitated by someone. Active का मतलब कि community खुद आके एक topic पे बात करेगी. Hidden cases, active surveillance is hidden cases. Similarly here, active discussion means community will themselves discuss. Passive means you will ask them to discuss and let happen whatever is happening. And facilitated means you will ask them to discuss, but in between you will ask correct question, you will direct them towards a conclusion. So this is facilitated discussion by some expert, and they can give you two type of image based question here, that which FGD is good. So in this first FGD, you can see everyone is saying something and they are discussing. So this is good. But in this second FGD, seventh person, maybe he is a head of sarpanch or someone who is not letting other people to speak. So only 7 and 1, maybe 7 is the wife and 1 is the husband. They are the head and they are only speaking. So this type of FGD is a bad FGD. It should not occur. There should be free exchange of idea between the people. So this is one area which we usually leave. Do remember them. Now, next one question is, which of the following is not a priority in NSSK? I hope you all know NSSK is Navjat Shishu Suraksha Karyakram, and in NSSK we focus on 4 things. देखो, बच्चा जैसे पैदा हुआ, पहले हम इन्फेक्शन रोकने की कोशिश करते हैं, फिर उसको ठंडी से बचाते हैं. इन्फेक्शन रोकने के लिए क्लीन कट कॉर्ड और सब है, ठंडी से बचाए. अगर दोनों काम हो गया, बच गया ठंडी से और इन्फेक्शन से, तब हम कराते हैं उस बच्चे का एक्सक्लूसिव ब्रेस्ट फीडिंग. ये है तीसरा वर्क. एज सुन एज पॉसिबल ब्रेस्ट फीडिंग स्टार्ट करते हैं. और अगर नहीं बचा तो हम कराते हैं नियोनेटल रिसक्सिटेशन. So what you are saying in Hindi was, in NSSK we do 4 things. First, we prevent from infection, hypothermia. If we are able to prevent them, then we will do breastfeeding. If we are unable to prevent, then we will do resuscitation and try to save the life of the child. So these are the 4 work in NSSK. This free investigation of newborn, this is done under program JSSY, Janani Shishu Suraksha Yojana, in which the logo, if you see, there will be yellow color mother, yellow color child. कैसे याद रखोगे? See, child, S stand for Shishu. Shishu means child, and you know child keep doing susu. So child keep urinating. So due to the urination, the logo color is yellow. JSSY, which is for both mother and child, have this yellow color logo, and it does 3 things. Free investigation of newborn, and it also gives free investigation to mother. Along with that, it gives free ambulance and free food. So this free food is given for 3 days in case of normal delivery, and it is given for 7 days in case of C-section delivery. And if they ask that there is a poor female who don't have money to go to hospital, which program will help him? Will it be JSSY or will it be PMSMA? So if poor female do not have money, then JSSY give the money for ambulance also, and therefore only JSSY can help her. There is one program which I want to discuss, PMSMA, Surakshit Matritva Abhiyan, Safe Motherhood Mission. This started in 2016, and this say that on 9th, everything is free in government hospital. There will be free ANC checkup, free treatment, investigation, etc. in government hospital. But the sad news is, the good news is, it is free on any day of the month. So in PMSMA, government is giving something free on 9th, which is free on any day of the month. So basically 9th को दे रही है बाबा जी का ठुल्लू. but it is, you have to remember that in the logo there is two hand holding the mother. That is the logo of hand of Prime Minister himself, and he is trying to give safe motherhood by giving 9th of every month free NC checkup. And this 9th of every month free NC checkup is there, but still it will not help poor female who don't have money. Even on 9th it will not help, because it is not giving money for ambulance. Ambulance money is only in JSSY. So PMSMA do this thing free on 9th. Other than that, it allow private ops and gynae that they can go on 9th and they can do ANC checkup. The third thing is, it is classifying pregnancy: red for high risk pregnancy, blue for pregnancy with hypertension, leg eclampsia and pre-eclampsia, yellow for pregnancy with comorbidity, like someone have diabetes or let's say hypothyroidism, TB, that is yellow. And of course green, which is also in triage, you must have read that it is for ambulatory patient, stable patient is green. So here also green is for normal pregnancy. But do remember, for triage they ask this question that which is relatively stable. Relatively stable is yellow, red or yellow. So fully stable is green. And not, they just need dressing, cast, and they are, that's why ambulatory, because we can move them from one place to another through wheelchair or stretcher. But if they ask relatively stable is not green, that is yellow, because they are more stable as compared to red category in the triage. Okay, and this is NSSK. You can find these are the 4 things: prevention of hypothermia infection, early breastfeeding, and newborn resuscitation. 4 things in NSSK. Now, one more thing which we usually miss and don't revise, but being asked in NEET, is how much money which you will give to mother and ASA or USHA for delivery in hospital. So under JSY, we give this money, and the money given depends whether the state belong to low performing or high performing. If it is low performing states are those in which mother and child death rate is high. And the first name is, of course, my state, United States of Bihar, USB. Hai na? So Bihar is first, then there is the neighbors of Bihar, UP and MP, and then their brother like Jharkhand, Uttarakhand and Chhattisgarh. So these 6 are low performing, and then the remaining 4 can be remembered by the mnemonic Roja Jane Man Tu Hi Mera Dil. Hai na? So R is for Rajasthan, O for Odisha, J for Jammu and Kashmir, which also include Ladakh now, and A for Assam. So total 10 states are low performing. And of course, in low performing, we give more money. In high performing, we give less money. So how much money is given? It's a table directly from PAAR. You can understand this table very easily. See, in urban area, ASA always get 400, and in rural area, USA always gets 600. So sometime USA is also called as ASA. Like here in PARK, you can see they have written ASA in place of USA. Don't get emotional there. ASA is urban USHA. Same thing almost. Same, but little bit different. Only difference is that ASA is at a population of 1,000 in rural area, and USHA is at a population of 1,000 to 2,500. Roughly speaking, USA is at 2,000 population. So money is 400 for urban area, 600 for rural. Done. Rest 4 you can remember by 1400, 700, 1000, 600, 1400, 700, 1000, 600. Of course, we give more money to low performing. So low performing get 1400 in rural area, and then half of that is 700, 1400, 700 for rural area. Then low performing get 1000 rupees in urban area, and half of that is 500. But mother never get less than ASA. So she get here 600. That's why you have to remember 1400, 700, 1000, 600. First remember 400 for USA, 600 for ASA. Then 1400, 700, 1600. Now if you go back and cross check it, where the delivery is occurring, Mumbai. So Mumbai definitely means it's an urban area. Because it's an urban area, so money is 400 decided. So this is how you can decide, okay, A, B will be the answer. Now Mumbai belongs to Maharashtra, and Maharashtra is not in low performing, it is high performing. So because it is high performing, correct answer will be 600. If in place of Mumbai, I would have written, let's say, MP, urban state of MP urban area. So for MP urban area, which is low performing, money is 1000 in the low performing states and 400 to Usha. So this question has been asked in NEET, MP urban area 1400. But if they ask Mumbai, 600, 400. Like that, I hope if you remember the table and 10 states, you can tell it easily. And to remember the table, remember 1400, 700, 1000, 600. Okay. Then, which of the following is not included in JSY? This is a very debatable question. Because we think JSY only give money. But recently, Government of India has included 5 more work under JSY. So first work, if you can answer it, please answer it and see it. First work which has been asked in PYQ FMCE is Village Nutrition Day. This is known as Mamata Divas. और पता है आपको ममता दिवस मनना चाहिए वेस्ट बंगाल, बट सबसे ज्यादा मन रहा है गुजरात के गांव में. मोदी मना रहा है ममता दिवस, है ना. मैं बता रहा हूं उनके बीच में कुछ चल रहा है. मिलेंगे दोनों एक दिन चने खाते हुए साथ में नदी किनारे, है ना, या समुद्र किनारे. सो दिस इज विलेज न्यूट्रिशन डे ममता दिवस, which is one work under JSY. Second is maternal tracking. I was just joking that Mamta Divas is mostly celebrated in Gujarat, hai na? So Modi is celebrating Mamta Divas. And this is Village Nutrition Day, one work. Second work is we track the mother. How we track the mother? We track the mother by a green color logo software, Anmol. Anmol is A&M online. So this is for tracking of high risk pregnancy. So that's why it is maternal tracking. It is A&M tablet based software. This software was launched and all A&M ask only one question from government. My kind government, you gave us the software, but where to put it? Where is the tablet? Where is the hardware to put this software? And the government said it will come, don't worry. So do remember, Village Nutrition Day is one thing. Maternal tracking is second. Third work is maternal death review. If anyone die, they will do the review. Fourth work is safe abortion services. Safe abortion. And fifth work is Vande Mataram. So what is Vande Mataram? Vande Mataram simply means the MBBS doctors and some gynecologists, they can put the logo of Vande Mataram program over their OPD and hospitals. And if they put this logo, government will give them all the things that they give to ASA for distribution, like IFA tablet, TT injection, oral pill, which they can give to the needy people of their area. So what are the 6 work in JSY? First work is money is given to mother. But money is not given before and after delivery both. If you give money before and after delivery both, then this program became PM Matru Vandana Yojana. I will show you the logo of this program. In this program, mother and child both are incomplete, half mother, half child. Because this program is also only half implemented. Incomplete program, incomplete mother child. Why this is incomplete? Because I am sure none of you have seen money given before delivery. And this program says that we will total give 6,000 rupees. Now we will give 6,000 rupees. In this 6,000 rupees, first 2,000 rupees installment will go at 12 week when mother come for pregnancy checkup. Then the next 2,000 rupees is given at 6 months of pregnancy. And last 2,000 rupees is given at 6 week when mother come for first vaccination. Previously it was 5,000 rupees. Now the government increased it to 6,000. Because जब फेंकना ही है तो बड़ा फेंको. When we are throwing, let's throw 1,000 more. So do remember, PM Matru Vandana give money before after delivery both. In JSY, money is given only after delivery, not before after delivery. So which one is not correct? First statement is not correct, that money is given before after both. It is only given before after delivery in JSY. Before after JSY, after delivery money. And in our time, actually, when mother used to come for next delivery, money of previous delivery used to come in her to her, and so it used to be very delayed in our time. So JSY money after delivery, before after Matru Vandana. And do remember the 6 work of JSY. How will you remember? Very simple. V for Village Nutrition Day, V for Vande Mataram. So V, 2 things from V. Village Nutrition, Vande Mataram. M for maternal tracking, M for maternal death review. M, two thing, and then M also for money. So 3M, 2V, and 3M is there. Last thing is safe abortion services, which is very important for healthy females. Okay, so that is there. Now, which of the following is a denominator of, let's see the logos of all the mother-child program, because this mother-child logo has been asked in NEET exam already, and I am expecting that they will ask it in one of the logo will definitely come in your exam also. So let's go through the logos if that is there. I have put some extra images, but I hope we will be able to discuss the important thing at least. So this, as I was saying, was tablet-based software, green color mother, green color child, ANM, which has already been asked. If it is yellow color mother, yellow color child, I said it is JSY, free investigation, free ambulance, free food. If it is blue color mother, blue color child, it is UNICEF. And do remember this one question which came, that seed and manure of applied nutrition program also come from UNICEF. So it's not difficult to remember. Green Anmol, blue UNICEF, yellow Susu JSSY due to urination of kid Sisu. Then if it is incomplete mother child, as I said, incomplete mother child is PM Matru Vandana Yojana. Matru Vandana, you can see half mother, half child. If it is white color mother, white color child, white color they consider foreigner. So this is WHO program, BFHI, Baby Friendly Hospital Initiative. And do remember this question has already been asked in NEET exam, that BFHI do not focus on prevention of infection. In US, UK, infection focus is now our focus, because they think that if breastfeeding is started adequately, milk will protect the child from infection. So they do not focus on infection prevention. What I expect in this exam is this black color mother, black color child. This is the logo of 𝐿𝐾𝐬. What is the work of 𝐿𝐾𝐬? I hope you know. This is improvement of facility in labor room and maternity ward. So these are the 6 logo. Black is 𝐿𝐾𝐬, white is BFHI, incomplete is PM Matru Vandana, yellow is JSSY, blue is UNICEF, and green is Anmol. Okay. Then we will come back to the logo, but these are the logo with 6 logo with mother child. I hope you will remember them separately. This is the logo of Poshan Abhiyan, the nutrition. And you can see the tree growing. And this Poshan Abhiyan have many programs under it. One is definitely the very important Anemia Mukt Bharat. Then there is Anganwadi. So A for anemia, A for Anganwadi. The other 3 have Poshan written in it. And I will come back to this Poshan question. This is the question which I have put also for you, that in the Poshan Abhiyan, which is the thing done? And this is the question. In the 𝐋𝐚𝐬𝐭 Poshan Yojana, what do we do? How much money we give, or what do we do? So 𝐋𝐚𝐬𝐭 Poshan previously was giving 500 rupees for TB patient for nutrition. But in the new update, the money given in 𝐋𝐚𝐬𝐭 Poshan is 1000 rupees per month for nutrition. This is 𝐋𝐚𝐬𝐭 Poshan. Then second thing is PM Poshan. PM Poshan is same thing as midday meal program. And in midday meal, this is a very common question they ask, how much protein, how much calorie is given. So if you know the reality of India, most of the mother in India are eating only rice. And therefore children are also eating mostly rice in the rural parts and peripheral areas. So if they are eating rice, from the rice they can get the calorie, but they will not get the protein. चावल से उनको ताकत तो मिल जाएगी, कैलोरी तो मिल जाएगी, लेकिन प्रोटीन नहीं मिलेगा. तो इसीलिए हम स्कूल में ज्यादा प्रोटीन देते हैं, because they cannot get protein from rice in home, so we give more protein, half protein and 1/3 calorie. I hope you will remember it with the logic. More is the protein, less is the calorie. And the new thing done in PM Poshan is now preschool children will also get the midday meal. Although in school, in the government village area, preschool children anyway don't come to school. They go to Anganwadi. But government said, so what? We will still give them food here. So this is the thing in PM Poshan. So we have read about 2 Poshan, 𝐋𝐚𝐬𝐭 Poshan, PM Poshan. After 𝐋𝐚𝐬𝐭 Poshan, PM Poshan, the third is 𝐋𝐚𝐬𝐭 Poshan, PM Poshan we did. Then there is adolescent program. adolescent program like Rashtriya Kishore Swasthya Karyakram. In the logo of RKSK, you can see some people playing kites, some children playing kites, because government think कि adolescent between 10 to 19 year यही है वो जो पेचे लड़ाते हैं, पतंगे उड़ाते हैं. They are the one who tie knots and play kite. So in the RKSK program, you can see the kite. RKSK also come under POSHAN. So POSHAN have 5 things under it. One is PM POSHAN, second is 𝐋𝐚𝐬𝐭 POSHAN, third is adolescent, fourth is Anemia Mukt Bharat, about which we read in last session also, and you must be knowing, and fifth and last is the Anganwadi program. So 5 things come under POSHAN. They can ask which do not come under POSHAN, like they have already asked which do not come under GSY. In the Anemia Mukt Bharat, of course, the target is reduce anemia each year by 3%. So 3% reduction is Anemia Mukt Bharat target. And if you look at the target of POSHAN Abhiyan, so to remember the target of POSHAN Abhiyan, there was a student in Mumbai whose Naveen was his name. He suggested me this idea that, sir, you can remember it by LUSTY. LUSTY is the LUSTU is the target, because in POSHAN Abhiyan, our target is to reduction of low birth weight for L, underweight and stunting, and each has to reduce 2%. Anemia Mukt Bharat target is 3% reduction, but POSHAN Abhiyan target is 2% reduction. So do remember 3%, 2%, and LUSTY is for POSHAN. Now similarly, they have asked in past, which is not a target of Global Hunger Index. So in the Global Hunger Index, the target can be remembered by a very simple mnemonic, fuck US 5 times. FUS. What is FUS means? F stand for what are the 3 target in Global Hunger Index? U and S are same. First U is same here, underweight. POSHAN में भी underweight था, यहाँ भी underweight है. S is for stunting. So same LUSTY, LUS, and here US is same, underweight stunting. F stand here for under 5 mortality rate. Under 5 mortality rate. Because भूख के चलते 5 साल से छोटे बच्चे मरते हैं. Due to malnutrition, death occur mostly in less than 5 years. One of the main reason. So under 5 mortality is one thing in Global Hunger Index. Second is underweight. Third is stunting. This question has came, which is not a target of Global Hunger Index. So I hope you understand. These 3 are the target. Rest all think like infant mortality rate, IMR, is not a target. IMR is not a target. The target is of course under 5 mortality, underweight and stunting. FUS is Global Hunger Index target and LUSTY is POSHAN target. These are the area which we usually don't revise, and this is being asked, recently being asked, so you have to remember it. Now what is the incubation period of lymphogranuloma venerum? It's 3 to 30 days. Do remember, maximum incubation period is the time up to which we keep a person in quarantine, because quarantine is done on the people who look healthy. So they ask incubation period again and again, which is very difficult to remember for all of us, but we can remember it with some logic. Like if you remember MCI, Medical Council of India, M stand for meningococcal meningitis, then there is C for cholera and I for influenza. And all these 3 have 1 to 3 day incubation period. But we cannot take risk in case of cholera. So for cholera, maximum incubation period is 5 days. So MCI 1 to 3. And if you double 1 to 3, it comes diphtheria. So D for double, D for diphtheria, 2 to 6 days. Then after diphtheria, there is plague, 2 to 8 days. But in the prehistoric time, when we know nothing about them, we used to quarantine for 40 days till the person die. Like in North Korea, 1 case of COVID came, and how they managed it? Shoot him. No more need of quarantine. So similarly, in prehistoric time, we used to quarantine till death, so 40 days. But now in PAAR it is written for plague 2 to 8. So between 6 and 8, 2 to 6 diphtheria, 2 to 8 plague, what is left between 6 to 8? 7. This 7 to 14 is polio and pertussis. P for polio, P for pertussis, double P, double of 7. So there are 3 P. Plague come first because it is old disease. Then there is polio, pertussis. And then there is mumps and rubella for 14 to 21 days. So with this, we can remember most of it. 1 to 3 MCI, diphtheria 2 to 6, then 2 to 8 plague, 7, 14 polio, pertussis, mumps, rubella, 14 to 21. Only left with 2 things. 14 to 21 is mumps, rubella, 10 to 21 is chicken pox. For chicken pox, incubation period or quarantine is 10 to 21, but they have asked it already in NEET exam. The isolation period for chicken pox is 6 days. And if there is a girls hostel or boy hostel in which infant are not living, pregnant and old age people are not there, then we don't give varicella zoster immunoglobulin. And we only isolate the case. If in your hostel 1 case of chicken pox occur, you will isolate them and you will not give immunoglobulin to other because you are adult people. So 10 to 21 days for chicken pox and 10 to 14 for measles. Remember, measles is the only disease in which the antibody develop first. Antibody develop in 7 to 8 days, and then the symptoms, of course, symptoms come at 10 to 14. So लक्षण आने से पहले सिपाही तैयार हो जाते हैं. Before the symptom come, antibody is ready. But still, measles vaccine is also not given in disaster. So what are the vaccine which we given in disaster? Answer is no vaccine is given to in disaster. Only 3 vaccine, that is tetanus, typhoid and cholera. This is given, and that also not to general public. These 3 are given to doctors and health workforce, given to health workers who come to rescue. So no disaster vaccine is given. This is directly written in PAAR, and this is also CDC and WHO guideline. Then the next question is that which of the following is not a duty of ASA? So giving immunization is theoretically not a work of ASA. Second thing which is not a work of ASA is that the other with immunization, they don't conduct delivery. And this is same thing for Anganwadi worker also. ASA and Anganwadi worker, they both don't do 3 things, 4 things actually. First thing, they both don't give vaccine, but they are paid for every vaccine. They don't give it, but they are paid, except they are paid for every vaccine, but not paid for OPV 0 dose, BCG and Hep B. So if they are paid for every vaccine, why not for this? Because their reason of payment is they act as motivator, and they will motivate the mother for vaccination. But these 3 vaccines are given at hospital. So whom the ASA will motivate? Father-in-law, Sasurji. There is no one to motivate. So ASA don't get paid for these 3, but she get paid for all other vaccine because of acting as motivation. Then they don't conduct delivery, of course. They help mother during delivery, but don't conduct it. Third thing they don't do is they don't make malaria slide. So I hope you all know who make malaria slide. Malaria slide, we have discussed it in last session also, is made by MPW, by active surveillance. And thin slide is for species. 𝐿𝐼𝐞𝐬𝐿 is the gold standard. Then the fourth is they don't measure birth weight, because to measure birth weight, there is ANM and nurses who are conducting delivery, and birth weight is measured at the time of delivery in hospital. So this is also not a work of ASA and Anganwadi. These 4 are not the work. They do distribute condom OCP. They do ensure whether government program is working or not. This is all their work, but immunization, delivery, slide making and birth weight measurement is not their work. Okay. Then one question they keep asking is from sensitivity specificity, and because they're asking 4 or 5 numerical, it can come this time. But we forgot in exam usually what is the formula. So do remember, sensitivity only deal with disease people. And when we talk about specificity, specificity only deal with people without disease, non-disease. This much you can remember, disease, non-disease. Now the thing which you already know is sensitivity is true positive and specificity is true negative. Okay. So this one basic formula can help us in solving many questions. Like they are here asking sensitivity and specificity. And as I said, that sensitivity is true positive by disease. So how many are people with disease? Disease is 30 people. So disease people is 30. Now where is true positive? True positive का मतलब जो बीमार भी है और पॉजिटिव भी आया. So you can see disease and positive, true positive is here. And what is true negative? True negative are those who are without disease and are excluded also, came negative also. जो negative भी आया और बीमार भी नहीं है वही true negative है. So true negative is always on D and true positive is always on A. Sometimes they can change the table. They can write disease in the left side, test positive, negative above. Even if they change the table, true positive, true negative remain at the same place. A, D do not change its place. So if they ask sensitivity, what is true positive here? True positive is 27. And 27 by 30 into 100 if you do, it will come 9 by 10 into 100 or 90%. So sensitivity is 90%, option A is correct. Similarly, we can find specificity also. How many are non-disease? देखो कितने लोग हैं जिनको बीमारी नहीं है? 100 are non, 100 are non-disease. And out of 100 non-disease, how many are true negative? 95. So true negative is 95, non-disease is 100. Of course, it will come 95%. So specificity is 95 and sensitivity is 90. This is one way of doing the question. Then some question, they ask you to identify the formula of specificity. 3 times it has been asked. Just identify the formula. See, so easy to identify. In the non-disease, there are 2 type of people. एक जिनको निकाल के बाहर कर दिया गया वो है non-disease में. दूसरा जो गलती से पॉजिटिव आ गए, बीमारी नहीं थी फिर भी पॉजिटिव आ गए. In the non-disease, there are 2 people. One who are excluded, true negative. One who are wrongly coming positive, false positive. So to remember the formula of specificity, it is so simple. You just have to remember true negative. Can you remember true negative? Specificity have true negative. We already know it. If you remember true negative, in the denominator, you can see there is again 1 time true negative. And then there is just opposite of true negative. What is opposite of true? False. Opposite of negative? Positive. So you just have to remember true negative and then true negative and just opposite of that false positive. And your formula will always be ready in your mind. आपको बस true negative याद रखना है और नीचे में true negative है और उसका just उल्टा है. True का उल्टा false, negative का positive. तो true negative false positive हो जाएगा और हमेशा याद रहेगा. Similarly, if you look at the sensitivity formula, in the disease people, there are 2 type of people who are with disease. One who got caught and one who wrongly came negative. False negative is miss out. And we have discussed it yesterday also that this is beta error. How many are miss out false negative? And false positive is alpha error or p value. बिना बात के ही alert हो गया, खड़ा हो गया, that is false positive. बिना बात के ही positive आ गया, without disease you came positive, that is false positive. So in the formula of sensitivity, if you see, again you just have to remember that sensitivity is true positive. In the denominator, you just will write true positive again and just opposite of true positive. What is opposite of true? False. Opposite of positive, negative. So if you remember that sensitivity true positive by disease or true positive and then true positive and just opposite is the way to remember this formula forever. Okay, so I hope you will remember it. Then if they ask formula of PPV and PV, remember PPV has everything positive. It is also having true positive in the numerator, then true plus false positive. And NPV has everything negative, so we will write true negative, then true negative plus false negative. So this is simple to understand PPV and PV. And do remember, PPV, as we have discussed yesterday also, depend on prevalence. Directly proportional to prevalence is PPV. So now this is the question. Let's do one more question on this concept to make it clear. This is one of the PYQ. They are saying that we are doing ovarian cancer estimation and 60 out of 100 who positive actually had ovarian cancer. So 100 is total positive. And total positive include 2 things, true positive plus false positive. And they are saying that out of 100 total positive, how many have disease? 60 have disease. So this 60 people who have disease, they are true positive. True positive means disease and positive. So 60 by 100 is true positive by total positive, first information. Second information is 20 out of 100 women who test negative had ovarian cancer. So total 100 people are total negative. And out of total negative, there is two things, true negative plus false negative. So total negative is 100. But out of this 100, see this line very carefully, 20 are with ovarian cancer. That means they had the disease and they were miss out. बीमारी तो थी लेकिन पकड़ी नहीं गई, निकल के स्लिप हो गई, मिस आउट हो गई. फॉल्स निगेटिव को ही कहते हैं मिस आउट, कि कितने लोग पकड़े नहीं गए. और यही हो रहा है इन 20 फीमेल के साथ. दिस इज व्हाट हैपनिंग विद दिस 20 फीमेल. दे आर कमिंग नेगेटिव but they actually have disease, so they wrongly came negative. They are underestimated. That is false negative, which is 20. So we know this thing. Now they are asking to know negative predictive value, NPV. And what is the formula of NPV? NPV is true negative by true negative plus false negative. So we already know true negative plus false negative, total negative is 100. So in place of this true negative, false negative, answer will be 100. Now the main question is how much is true negative? True negative kitna hai? So see this. Here false negative is 20 and total is coming 100. So true negative will be 100 minus 20. 100 minus 20 will be how much? Because true negative, false negative दोनों को जोड़ के 100 आता है. False negative 20 है. तो ट्रू नेगेटिव कितना बचेगा? 80. इफ यू ऐड टोटल नेगेटिव 100, ट्रू नेगेटिव विल बी टोटल नेगेटिव माइनस फॉल्स नेगेटिव. सो ट्रू नेगेटिव इज कमिंग 80. देयरफॉर आंसर इज 80 by 100. So this type of question can also come. Just two numerical, no more numerical. Sorry for scaring you out. Just two last numerical which can come. Oh no, there is one last numerical. Just last. This is the numerical on quartile. Whenever numerical come on quartile, what you have to do is take the sample size and divide it into 4. What is the sample size? 200 people. So divide 200 into 4. It will come 50. Now in the quartile, 0% is here, then 100% is here. In between there is Q1, first quartile 25%. And third quartile 75%. So Q1 and Q3 are 25-75 percentile. This is what they usually give. That first quartile BP is 94. What is 25%? 94. Then third quartile is 110. This is 110. This is 94. Now the question they are asking is how many patients have BP between third and fourth quartile? So थर्ड क्वार्टाइल का मतलब 75%, फोर्थ क्वार्टाइल का मतलब हो गया 100%. तो 75 से 100% के बीच में कितने लोग आ जाएंगे? तो इसके लिए तो हमें सॉल्व कुछ भी नहीं करना था. अगर वो पूछ रहा है कि 75% से 100% के बीच में कितने लोग आएंगे, तो 25% लोग आएंगे. और 200 का 25% कितना होता है? 50 होता है. तो आंसर कितना हो जाएगा? 50 हो जाता है. What I was saying in Hindi was, in this question they are only asking how many people are between third and fourth percentile. That means how many people are between 75% and 100%. Between 75% and 100%, it's quite obvious, 25% people come. And 25% of sample size 200 is 50. So answer is 50. If in the question they ask how many people are between Q1 and Q3, so between Q1 and Q3 you can see there are 50% people, and 50% of 200 is 100. So 100 people are between first and third percentile, and 50 people are more than third percentile. Similarly, 50 people, which is 25% of total, is less than first quartile. So simply divide it into 4 and then look what the question is asking and you will be able to answer. So this type of question has already been asked and can ask again. Now, one very confusing question which is being wrongly discussed by me also sometime in the past, that which is not limited by time, not constrained by time. So if they ask not constrained by time, answer will be goal. Goal is not constrained by time. Why this is the answer? Don't be distracted by anyone saying anything. Just simply look at the PAAR. PAAR is saying goals are not constrained by time, not limited by time. Goal is not time limited. Target, objective, vision, all are time limited, but not goal. So not constrained by time is simply PAAR line goal. Then they can ask this good interesting question that let's say someone want sperm of Virat Kohli or sperm of Lata Mangeshkar. Sorry, no sperm in Lata Mangeshkar. Ovum will be there. Ovum of Lata Mangeshkar or sperm of Virat Kohli, like this type of thing they want. So if they want this type of thing to be given so that we can improve genotype of the population by giving burden of parenthood to carrier of desirable genotype, like process of artificial insemination. This will be positive eugenics, negative eugenics, both A and B, or D, euthenics. So this question has been asked in past with a different type of language. They ask improving IQ of children who are autistic. Improving IQ of autistic children by training or regular school or training or practice. This is an example of euthenics. यूथेनिक्स का मतलब है कि जीन चाहे कितना भी बेकार हो, जेनेटिक प्रॉब्लम भी हो, हम एनवायरमेंट ऐसा दें कि जो भी जीन हो वो अपनी अच्छे से अच्छे तरीके से अपने आप को एक्सप्रेस कर पाए. Euthenics means giving such a good environmental condition that even if the genotype is wrong, expression of gene will be beautiful. Like here, you are giving good training so that even if the child is autistic, their IQ is improving and they are working better. So euthenics is improving IQ by this thing. Then negative eugenics is what Hitler did. Hitler said that no one who are having some disability or short stature, they cannot reproduce. We will produce pure Aryan breed. So negative eugenics means preventing people from reproduction. But Hitler forget that he himself was short statured. So anyway, Hitler did negative eugenics, preventing people to have sex or reproduction so that we can improve genotype. But if you are improving genotype with the help of Virat Kohli or Lata Mangeshkar gene, that is positive eugenics. Artificial insemination is positive eugenics, preventing people from a negative, and then of course this is the thing which is clear, I hope. Now there is a debate on question of maternal mortality rate and maternal mortality ratio, which they keep on asking. So if they ask the denominator of maternal mortality rate, not ratio, can you tell me what is the denominator of maternal mortality rate? Is it number of live birth? Is it number of female between 15 to 49? Is it number of maternal death within 42 days or number of death within 1 year? So number of live birth is the denominator of maternal mortality ratio, not maternal mortality rate, but maternal mortality ratio. What is the difference between ratio and rate? Ratio means numerator is not a part of denominator. For example, when we talk about sex ratio, in sex ratio ऊपर कौन होता है? हमेशा याद रखना, ऊपर होती हैं female, because only female has the capacity to give birth to new child. So we put sex ratio female above, male below, multiply by 1000. So if sex ratio they ask, female by male is there, and does female come from male? क्या female male से पैदा हुई हैं? नहीं, female do not come from male, they are different. That's why it is ratio, because numerator is not a part of denominator. But maternal mortality rate means this time we will put the denominator as number of female between 15 to 49 year, and numerator is number of maternal death within 42 days of delivery due to delivery related causes. What is the difference? Let me explain this question here with this two formula written together. When we talk about rate, रेट में हम लोग फीमेल को नीचे लिखते हैं और उन फीमेल में से जो मर गई ऊपर लिखते हैं. यानी रेट में आप देख सकते हो न्यूमरेटर डिनोमिनेटर में से निकल के आया है. What I was saying in Hindi was, in the rate you can see that out of some female, some maternal death occurred. So number of female we write below, out of which some dies. So numerator is coming from denominator. Numerator is a part of denominator. That's why it is a rate. But in ratio, numerator is maternal death, and denominator we write is live birth. How many live birth occur? And live birth does not give to maternal death ना, है ना? बच्चों में से कुछ मां मर रही हैं, ऐसा थोड़ी है. So live birth is not a part of maternal death. That's why it is a ratio. Just like sex ratio, which is female by male into 1000, because female is not a part of male. Similarly, maternal death is not a part of live birth. That's why it is a ratio. And ratio is 1 lakh. And our target for MMR in Sustainable Development Goal is less than 70 per 1000. Less than 70 per lakh. Lakh means 50. Always, whether it's ratio or rate, we multiply by 1 lakh only. Difference is, in ratio we divide by live birth, in rate we divide by number of female. Ratio में नीचे लिखते हैं live birth, rate में नीचे लिखते हैं कितनी female है. Okay, live birth is ratio, rate number of female is rate. So if they ask rate denominator, it is number of female. Okay. Then next question is what are the things in GSY which we already discussed. Next two question I want to discuss very quickly is about one is about this ASA eligibility, which confuse you. Do remember, there is one ASA per 1000 only, and minimum education is 8th class only, not 10th pass. Okay, so it is 8th class and one ASA per 1000. 3 places in PAAR they have written it. Incubation period we all read. For quarantine it is needed. One thing which I want to tell you about wave of epidemic. So the wave of epidemic is how to decide the epidemic. For that we have to focus on incubation period. If incubation period, let's say in cholera is 5 days, and cases occur within 5 days, within incubation period, then we call it common source single exposure. Incubation period के अंदर सारे केस होंगे तो common source single exposure कहेंगे. Okay, but if it is taking more than incubation period, if it is taking more than 5 days, we call it common source continuous exposure. And propagated epidemic will have secondary wave of cases. Secondary wave of cases usually occur at some time gap, and then the second wave is always bigger. Like this is the secondary wave of cases which you can see in case of COVID. This occur like this, 2020 and 2021. So secondary wave, if found, it is propagated, and if the cases are more than one incubation period and secondary wave is not there, then we call it common source continuous exposure. So if you look at this wave, it is starting from 4th of some month, and then from the 4th the cases is increasing and then it is decreasing. So it's forming a wave like pattern, and cases are 4 to 61. 4 to 61 means roughly there is 56 days cases are occurring, and 56 day we all can see is more than 5 days. So cases are taking more than one incubation period. That's why it is common source continuous exposure epidemic. Now, some student can ask, sir, is it not secondary wave of case? No. Secondary wave of case will have something like this, which has been asked in MCI exam already. This is the first case, then there is secondary wave. It's totally big and large secondary wave. And then in between there is a gap also. Gap is not necessary, but the second wave should be significantly bigger. This should be successively larger peak and all. This is secondary wave, and this is example for cholera. And you can see cases starting from 4 to 18, more than 5 day time is taken, and this is there. Now, no, this is not for cholera. This was for measles. This was for measles. For cholera epidemic, incubation period is 5 days. If cases are occurring from 31 till 15, how many days there? 31 to 15. It means total there is around 16 days. So 16 days is more than 5 days. 5 दिन cholera का incubation period है, और यहाँ incubation period से ज़्यादा समय लग रहा है. Incubation period is 5 days, and here it is more than incubation period. So because it is more than incubation period, it is common source continuous exposure. Okay, continuous, because more than one incubation period. Like for example, hepatitis A incubation period is 10 to 50 days for hepatitis A. And if you multiply it by 3, it will become incubation period for hepatitis B, which is 30 to 150 days. So for A, 10 to 50 days incubation period, and cases of hepatitis A, you can see here, is starting from 27 April going till 21 May. So 27 April to 21 May means less than 30 day. And incubation period is 50 day. So cases are occurring within one incubation period. 50 दिन के अंदर सारे केस हो गए, 30 दिन में ही केस हो गए खत्म. So cases finished within one incubation period. That's why we call it point source epidemic or common source single exposure. So point source epidemic, when all cases within one incubation period, you have to check the date. Then remember incubation period and answer accordingly. And if it is more than one incubation period, continuous. If there is secondary wave, then that is propagated epidemic. So similarly, they can ask this question that if we are measuring about in the Massachusetts, there is an outbreak of salmonella and the salmonella incubation period is 1 to 3 days. So if this graph is given, it is which type of epidemic? See here, the cases starting occurring from 13 May occur till 16 May. So cases take 3 to 4 days. Incubation period is also 3 days. Cases also in 3 to 4 days. That means cases is roughly within one incubation period. So we call it point source epidemic because cases occur within one incubation period. So it is point source epidemic. Okay. Now just let's have a revision of Anemia Mukt Bharat doses also. If the doses is, they ask for adolescent. Adolescent is 10 to 19 years. This is the time when most of us has watched blue film for the first time. So the tablet which adolescent get is blue color. So we have to take the blue tablet, and it is, as I said earlier also, mnemonic is PBR, pink, blue, red. Just like PVR movie is released once a week, PBR is given once a week. So once a week blue tablet. And what is the dose? 60 and 0.5. This is the dose for adolescent. If I say 45 and 0.4 once a week pink tablet, this is the dose for 5 to 9 years. That's why it is pink, then blue for 10 to 19, and red tablet is in adult, we give it 60 and 0.5 once a week. But in pregnancy and lactation, we give it once a day. So this is the dose for pregnancy lactation, but not blue. This is the tablet is red color. And do remember, if it is children less than 5 years, we give them 20 milligram iron plus 100 microgram folic acid. See, if you multiply 20 with 5, it will come 100. So up to 5 years, we give 20 and 100, but we don't give it once a week. We give it twice a week by 1 ml IFA syrup. Okay. So this will help you in revising all of it. In red color female, we give it, adult female, we give it once a week. In pregnant lactation, we give it once a day for 180 days before delivery, 180 days after delivery. Okay. One last question I want to discuss here is, what is complete extension of family? If they ask, what is correct for complete extension of family? So complete extension of family means when first child leave home, that is complete extension. Now you will say, sir, if the child is leaving home, that is contraction. No, if child is leaving home, before that time it is extension. बच्चा घर छोड़े उसके पहले तक extension था ना, जब छोड़ गया तो contraction होगा, लेकिन end कब होगा complete extension? जब बच्चा घर छोड़ देगा तो फैलना बंद हो जाएगा, extension बंद हो जाएगा. When the first child leave home, then the family will stop extending, and that is the end of complete extension. So complete extension means birth of last child, first child leave home. Let's revise this cycle. First is formation, of course, marriage to first child. Then extension start, birth of first child, birth of last child. Then complete extension start, which is birth of last child, first child leave home. My family right now is in complete extension. क्योंकि हमारी तारें हमने कटवा दी है, we have done the tubectomy and the birth of last child is confirmed. This is the last child. Now we are waiting for our child to leave home, which are only 3 years and 1 year. They will not leave home soon. So that's why my family is in complete extension. But if you are still planning to have some more children, you are in extension. And if you are unmarried, you are not in stage of family. Your family is your parent family then. Till marriage it is start, of course. Then contraction means first child leave home, last child leave home. Complete contraction they can ask. Complete contraction means last child leave home and first spouse die. So this time they can ask complete contraction. Last child leave home, first spouse die is complete contraction. Dissolution is when both spouse die. Death of survivor also, then dissolution. Okay, so they can ask complete contraction this time. Okay, And do remember, when we calculate estimated average requirement, we calculate it for 50% people. When we calculate RDA, we calculate it for 97.5% people. That is why RDA, recommended dietary allowance, is always bigger than estimated average requirement. In the pasteurization, methylene blue test is done before pasteurization. Rest all detect the quality of pasteurization done. And when we do pasteurization, Holder VAT and high temperature sort time they ask. And it's very simple to remember. In the Holder VAT, there is 3 and 3, 63 for 30 minutes, 3. And in high temperature sort time, there is 2 and 2, 72 and 20 seconds. So 2 high temperature sort time, Holder VAT 63:30, methylene blue before pasteurization. This question they have asked in a different way, that in an HIV patient, which test of TB you will do first. Similarly, they can ask in diabetic, which test of TB you will do first. So whether it's HIV, there are 5 groups in which we directly do CB-NAT. Answer is CB-NAT. CB-NAT we do directly in 5 people. What are those 5 people? HIV, diabetic, COVID patient, previously treated, and pediatric TB. Why pediatric TB? क्योंकि पता है तुमको बच्चों को बोलोगे कि थूक दो तो मुद देंगे, मुद दो तो थूक देंगे ना. If you ask the child to use spit, they will not spit so easily. So we will calculate sample by lavage and all. It is so difficult to get it. That's why we don't want to waste the sample on ZN smear and directly send it to CB-NAT. So in 5 cases, we directly do CB-NAT. Do remember it. Okay. Previously treated diabetic, and one more is HIV, and one more is diabetic patient, diabetes mellitus. And of course, the good news of good advantage of CB-NAT is CB-NAT also detect rifampicin resistance. So in one test, you will know whether you have to start treatment of MDR or normal. And in MDR, we have already discussed yesterday that the regime is BPAM, okay, which bedaquiline prevent ATP synthesis. In a hospital, if you are trying to compare that whether kya kuch doctor gulcharre uda rahe hain na, they are just spending time talking with each other or they are doing the work. So if you are comparing them based on time taken, that is work sampling. But if you are making the decision with the help of feedback from group of people, suppose before selecting out of 2 surgeons, you want to know which one is better. So you took feedback from group of people in whose hospital the surgeon has worked previously. So this is known as Delphi method. You are asking from the hospital in which they have worked that whether they work or not. So Delphi method is a group technique by which we take feedback and we compare it. Then let's say all of them are asking you for a SR surgery post 3.5 lakh salary per month. Then you will ask in the interview what extra you can do with the same salary. One say I can do marketing work, one say I can do counseling work. So now you are comparing cost effectiveness. You are comparing that everyone will take the same 3.5 lakh salary. The one who also help in marketing is more cost effective. So if you are comparing cost effectiveness based on extracurricular activity or any other thing, this is known as extracurricular activity of 2 or more person. You are comparing cost effectiveness of 2 people. So when you compare cost effectiveness of 2 person or 2 program, this is known as system analysis. So what is system analysis? Comparing people based on what extra they can do. If you are comparing people based on their feedback from last hospital, Delphi method. And let's say there are 2 doctors. One is 𝐿𝐞𝐚𝐬𝐭, one is Ashwani. 𝐿𝐞𝐚𝐬𝐭 is doing surgery in 1 hour. Ashwani is doing surgery in 15 minutes. So work sampling says choose Ashwani because he is doing surgery quickly. Work sampling means based on time taken. Delphi method means people opinion. System analysis means comparing big people based on their extracurricular activity or cost effectiveness. But if I am doing surgery in 15 minutes, it's not necessarily that I am doing correct surgery. Maybe I am connecting wrong wire together, and now whenever patient cough, he had an erection. है ना, जब भी खांस रहा है पेशेंट खड़ा हो जा रहा है तो गलत तारे भी जोड़ सकते हैं ना. Using work sampling is not always good. That's why we should use all the 3 methods in choosing people. Okay, but there is one more question which I want to discuss. That is the question of, let's say you got 50,000 rupees, and out of that 50,000 you give 30,000 for category A drug, 20,000 for category B, and 35,000 then 10,000 for category B and 5,000 for category C. Which type of analysis it is? So this is known as ABC analysis. This ABC VED analysis, but this is only ABC analysis. If you are just comparing the cost, it is ABC analysis. And if along with the cost, you are also deciding which drug we should give preference, then we call it ABC VED. ABC VED is used for inventory management. Inventory management means drug store management. Because if you have your own hospital, you don't want drug to be in shortage and you don't want drug to get expire. So what you have to do is first prepare a list. What are the drugs which are always needed? These drugs are category A. We give 70% fund to it. And 70% of 50,000 is 35,000. Then you prepare the list of 20% drug which are better if present. And for better category drug, we give 20% fund. Then you prepare a list of those drugs which are rarely used. They are usually kept as control. These are about 70% of the drug. And for them, we give only 10% fund. So if you are distributing the fund in 70, 20, and 10, this method of analysis is known as ABC analysis. And what is VED? VED stands for vital, essential, desirable. So vital means life-saving. And therefore, if you have to give the first priority we will be given to V and A category, which are vital and always needed. They should be given first priority, life-saving and always needed first priority. But this was the question being asked, that 50,000 divided into 70, 20, 10%, which analysis you will call only ABC analysis. And ABC, VED, both are for drug store management. Okay. So this part, these are weird question being came. Then they are asking questions from a step approach, which we don't revise. In a step approach, suppose I want to know, this is the last question for discussion, that you want to know whether Brazil has more high-risk people or India has more high-risk people for diabetes. What will be your answer? You don't know. So if you don't know, what you will do is you will randomly go to 5,000 population and ask them about some level of question. And with this 5,000 population, you will try to know which country have more high-risk population for NCD. Compare high-risk population for NCD. This is the work of step surveillance. It compare which country has more high-risk people. And to compare high-risk people, they have some category of test, some category of question, and they do some test in it. So to remember the test, you can use the mnemonic being suggested by one of my students, BTR Love. I don't know why he suggested it, and I actually know why he suggested it. So this is the mnemonic BTR Love, which are the tests done under it. So what are the tests done? B for, one is blood sugar. No, B is for BP and BMI. Two things. T for thyroid profile, R for random blood sugar, and L for lipid profile. L is not for LFT. L is for lipid profile. So which test is not done in step surveillance? Liver function test is not done. How can you remember it? By the mnemonic BTR Love. Then to remember what are the various questions which we ask. So first, when we go to the house, we ask them about the psychological question. And of course, psychological is known as behavioral. Because so in the psychological and behavioral, we will ask about क्या तुम सुट्टा पीते हो, क्या तुम दारू पीते हो, तुम exercise क्यों नहीं करते हो, diet, smoke, exercise we will ask. Then second level of question we will ask is physical. We will not get physical with the patient, but we will ask physical question, like we will ask about BP, BMI and their age. Last level of step, that's why it is a step surveillance, because there are three levels. Last is we ask the biological, and I can call biological as hormonal. So in the biological or hormonal, we have the three things, which is random blood sugar, thyroid profile, and lipid profile. So these are the tests. That's why the test mnemonic is BTR Love. But to remember the various things which we ask, various criteria being taken in step surveillance, you can use the mnemonic BPH, and it's not benign paroxysmal hyperplasia. You will forget that. The mnemonic is bum pe haath. Okay, do bum pe, ek haath, two bum, one hand. First B is for, you can use for behavioral, second B for biological, P is physical, P is psychological, and H for hormonal. So which factor not included? Therapeutic factor not included. Okay, so this is a step surveillance which help us to compare that India has more high risk people for diabetes or Brazil. And remember the two mnemonic BTR love and do bum pe ek haath. Last, seriously last question is, they can give you in PSM, micropedia, everywhere, image of question with child with different RAS. And how will you identify the RAS? See, the rashes of chickenpox and measles mostly occur on face. And chickenpox is chickenpox because just like beak of chicken, rash of chicken come out from the skin. That's why rashes of chickenpox is known as dewdrops on rose petal. गुलाब की पंखड़ियों पर ओस की बूंदें हैं ना. So chickenpox rash is out, measles rash is skin surface. And you can see in this child, the rashes are not coming out, it is in the skin surface. So in the skin surface rashes is the rashes of measles. Plus in measles, they will give the hint that rashes start from back of hairline or back of ear and then go to face. किसके पीछे से? कान के पीछे से. Start from back of ear and then go to face, that is measles. Second thing is, if there is chickenpox or rubella, chickenpox, rubella have dry rash. Dry rash means there is no cough, cold, coryza, conjunctivitis, but in measles there is cough, cold, coryza, conjunctivitis. Secretion will be coming from everywhere. But if you cannot see the secretion, like in this child, how will you decide whether it's secretion or not? You don't know. But one thing you are sure, it is not chickenpox, because rashes are in rashes of measles are sand particle like rashes. They are not coming out, they are within the skin surface. Now, how to differentiate between rubella and measles? See, rubella in common language is known as phool kumari. Flower rashes occur, they mostly occur on body and go away. So if they have given image of face, it is not rubella. It is either measles or chickenpox, and chickenpox comes out, measles is within the skin surface, and measles are with secretion. If you see secretion coming out, it is measles. Plus measles start from back of ear. So with this help, you can differentiate. Do remember, chickenpox is centripetal within the trunk. It do not occur on palm and sole. How to remember? CP for chickenpox, CP for centripetal. Okay, so this is chickenpox and this is measles with cough secretions coming out from everywhere. If they ask protein requirement of 65 kg female or 75 kg female, don't need to do calculation here. Just answer 45. Whether the weight is 65, 75, 85 does not matter. We give advice based on reference male, reference female. And I hope you all know, weight of reference female is 55 kg, weight of reference male is 65. 55 or 65, difference is 10 kg. And protein needed is not 1 gram per kg, it's 0.83. So if my weight is 100 kg, suppose, should I take 100 gram protein daily or 90 gram protein? No, advice is not given based on patient weight. Advice is given based on reference female and reference male. That's why all the male listening to this class right now, all the males should take only 55 gram protein per day, no matter what is your weight. And all the female, even if you are 95 kg or 45 kg or 35 kg, your protein is only 45. So if they ask female, female answer 45 directly without doing any calculation. If they ask male, male answer directly 55. That's all. No need of calculation. Male 55, female 45. This is the protein you have to remember. 45, 55. Weight you have to remember, add 10 kg in the protein, that is the weight, 55 and 65. Height is 162, 177. So height is 15 centimeter different, but they usually ask weight. Weight is 55 and 45. This is 65. So with this, I hope you can do a lot of question. Last one trouble area I want to go is the CD4 count, which is not my area. In medicine they discuss, but still we can discuss it with a very good diagram given in PAAR. See, PAAR has written that CD4 count less than 50 is CMV retinitis, CNS lymphoma, histoplasmosis, and Mycobacterium avium complex. So CD4 less than 100, MAC will not occur. MAC will occur if CD4 is less than 50, not less than 100. So answer here is MAC. Now, how to remember this question? One way is that history is old thing. So histoplasmosis is the only oocyst which occur in less than 50 CD4 count. Only one history is less than 50. And then between 50 to 200, there is all oocysts. So oocyst is between 50 to 200 except histoplasmosis, which is less than 50. And then CMV retinitis, CNS lymphoma, and MAC you have to remember. And there is one more oocyst, tuberculosis, which can occur in anyone. So tuberculosis is at CD4 more than 400. So in this way, you can do the question on CD4 count also. Sorry, I was not looking at the chat box properly because I wanted to cover all the important topic in 1 hour, whatever was remaining. And I think we have covered most of the topic. Just one last discussion of biomedical waste we can do in 1 minute. If nurse spills something, first step is we will do mopping. After mopping, internationally we say 0.5%, but in India we use 1% sodium hypochlorite, not 0.5%. Then they can ask again and again about some of this example, like they have asked, where will you throw broken vaccine vial? So broken vaccine vial goes in blue. If there is broken cytotoxic vial, cytotoxic drug vial like anti-cancer drug vial, then cytotoxic drug vial will go in yellow. But vaccine is not cytotoxic, so vaccine vial goes in blue. If they ask about culture plate or culture medium, remember culture plate look like plastic or glass, but all the microbiological waste goes in yellow. Okay, and we don't use sanitizer. If you can see dirt on the hand, then we will wash it, no need to sanitize. We already have discussed it. So cytotoxic drug is yellow, normal vial is blue. Plastic wrapper of syringe is not a biomedical waste, it is just a garbage, and garbage goes in black, so that is black. PPE kit goes in red. Syringe with fixed needle goes in white. People remember white for sharp, but where will you throw Caesar? Caesar don't go in white, Caesar goes in blue. Why Caesar go in blue? Because blue is something where if some instrument is thrown, blue have glasses and implant and instrument. So in blue, we put the things and then we autoclave them and we can reuse it. And Caesar we want to reuse. So Caesar goes in blue. In white, whatever we throw, we cut them into fine pieces and then discard them. So in white, we don't throw instrument. In white, if you remember, only 4 things goes in white, confusion will be done. What are the 4 things in white? Needle with fixed syringe, that has been asked. Syringe with fixed needle. Second is a scalpel, ustura, because in scalpel it's difficult to remove blade, so we directly throw it. Then all kind of needle, all kind of blade. Needle, blade, scalpel, and syringe with fixed needle. Only 4 things goes in white. Rest all thing goes, which are instrument, goes in blue. Okay. Then of course, I hope you know, if they ask blood bag goes in yellow, because in yellow we burn it, and blood is highly infectious, we want to burn it. Urine bag is less in number. Urine bag are more in number, and it is less infectious. If we throw urine bag in yellow, then yellow we have to burn it. Burning plastic will also produce polyvinyl chloride. We don't want to produce that much of pollutant, so we don't burn urine bag, we just recycle it. Therefore urine bag goes in red and blood bag goes in yellow. You can remember it, lal mein peela, peele mein lal. Red in yellow, yellow in red. Yellow color urine goes in red, red color blood goes in yellow. Okay, so this is there. Now, if a man, this question has been asked in MCI, that man came for checkup after his father had cerebrovascular accident. So what type of prevention if it is? Do remember, if the man came for physiotherapy, if man came, answer will be tertiary. But here man came for checkup, and PAAR has written clearly, all case of early diagnosis and treatment is secondary. So whether I am doing BP checkup of high risk person, let's say BP checkup of a person in whose family someone is died due to hemiparesis, like my father has died. So if you are checking my BP, that is also secondary. If you are checking BP of a healthy adult BP, purpose of BP checkup is always early diagnosis. So आपको हमेशा मकसद याद रखना, you have to remember the purpose. Purpose of any screening test is early detection. Therefore, all screening tests are secondary. If I said BP of a child, purpose of taking BP of a child is early diagnosis of nephrotic syndrome or some anatomical anomaly of the kidney. So no matter whose BP I am taking, whose screening test I am doing, all screening tests are secondary. Under tertiary, disability limitation come, and a very good example of disability limitation is refractive error glasses. When we wear refractive error glasses, it do not treat the disease. There is no treatment. It only make us self-dependent. So glasses making us self-dependent, not treating illness. And whenever we try to be limit our disability and become rehabilitate self, that is tertiary. So under tertiary, physiotherapy come, refractive error glasses come, and they will give image of filariasis patient foot care. This patient foot care also come under tertiary because this is limiting the disability. This is disability limitation, filariasis patient foot care. I hope you know primordial and primary. Primordial is when the risk is absent, that is primordial, and when the risk is present, absent right now, let's say primordial means risk is in future, that is primordial, and risk is in present moment, that is primary. Let me explain these two things very easily because they ask this question also, and I can ask it to you also, that mother and child linkage or mother breastfeeding, is it example of primary prevention, secondary prevention, or health promotion? So mother and child linkage is example of health promotion because health promotion include both primordial and primary. If you include primordial plus primary both, it is health promotion. So let me explain all this primordial, primary health prevention with one example. Imagine me as a lactating mother and suppose I am breastfeeding my kid. So my breastfeeding is preventing my kid from future risk of diabetes and preventing me from future risk of breast cancer. So this is primordial because risk is in future. Now I am again breastfeeding my kid, but this time from second breast because we have to keep changing every 2 hours and one side 20-minute breastfeeding so that hind milk can also go. So I'm again breastfeeding. I'm hitting his because beech mein daati kaat le raha hai na, he's biting my nipple in between. So this time the breastfeeding is preventing my kid from present day malnutrition. If I don't breastfeed my child today, he will be malnourished today. So risk is present at present moment, therefore we call it primary. So breastfeeding is both primordial, primary both. That's why it is example of health promotion, because health promotion is mother-child linkage. Health promotion is both primordial, primary. Future risk, primordial. Today risk, primary. Both health promotion. Okay. And what is not a pillar? Community participation is a pillar. And do remember, in community participation, who give the idea and who does the implementation? Idea monitoring both by community. तो आप बोलोगे कि डॉक्टर क्या करेगा? नाचेगा, and a doctor will try to bring the community together. But idea and monitoring both are by community. INICD question, remember it. Second pillar is appropriate technology is the second pillar. An example of appropriate technology they will ask is Sakir tape. Because in Sakir tape, if some child mid-arm circumference is coming less than 11.5, that will be red in color, and red color even illiterate female can tell that it is malnourished. So it is appropriate for rural area. That's why it's appropriate technology. Third is intersectoral coordination. That is also a pillar. Like Anganwadi and which is under Education Ministry, and PHC which is under Health Ministry, they both are working together. This is intersectoral. Equal distribution is not a pillar. Pillar is equitable distribution. That means giving more to those who need more. Like if you go to PSC as MOIC, your main focus should be the Harijan Mohalla, the slum area of the village should be your first focus. You should give more to those who need more. So remember the 4 pillar. It is appropriate technology, not adequate. And it is equitable distribution, not equal. They are playing with spelling, so be alert there. So let's revise the population norm one time and then we are done with all the discussion. One more last thing is, last question was this, that which category agent is botulinum? So botulinum is category A. A, you have to remember A and C. C is Nipah and Hunta. And with Nipah, they can give you date palm tree, fruit bat allowing it, and pig below it. So that is the life cycle of Nipah. Again and again, remember, fruit bat question has been asked. Category A is A for anthrax, B for botulinum, A, B. Then two diseases which are almost gone, smallpox and plague. Two diseases which are viral hemorrhagic fever, Ebola, Marburg. And last, seventh disease of category A is tularemia. So all three are in sequence. Tularemia is disturbing the sequence. Yahi bhadwa hai. And tularemia is disturbing it, the flow. So what are the seven in A? Anthrax, botulinum, smallpox, plague, Ebola, Marburg, and tularemia. Seven are category A. C is Nipah and Hanta. Hanta is transmitted by rat. Okay. So these are the various questions which is there and which I wanted to discuss with all of you. Only thing, last thing is population norm in National Urban Health Mission. I am guessing this, that they can ask this time what is the population norm of Mahila Arogya Samiti. Mahila Arogya Samiti is group of female who join together in slum area, hold monthly meeting and report it to Usha. So mass report to Usha. We have discussed Usha is at 1000 to 2500. But what is the population norm for mass? Mass is at 50 to 100 household. And Government of India think one household is for 5 members. So 50 to 100 household means it is 250 to 500 population for Mahila Arogya Samiti, 2000 for USA. USA report to Urban A&M. Urban A&M is at 10,000 population. Urban A&M report to Urban PHC, which is at 50,000. And then they report to Urban CHC, which is at 2.5 to 5 lakh. And Urban CHC, we can open near medical college or district hospital. This question has been asked. Can we open Urban CHC near medical college? Yes, we can open it. More serious patient will go to medical college. Less serious patient will go to Urban CHC. And then finally, there is medical college. So they can ask which is not present in urban area. In urban area, sub-center not present. Because you can see we have Urban A&M, but there is no sub-center here. And for rural area, we have already known sub-center is at 3,000, 5,000. And if there is type B, then on type B only delivery can occur, not on type A. Similarly, for PSC, you should know it is at 20,000 to 30,000. 30,000 for plain area because in plain people live close to each other. 20,000 for hilly area because in hilly they live far apart. So we need less PHC. At 20,000 we can adjust. And when it comes to the delivery, for PHC type A, there should be less than 19 or equal delivery is type A, and 20 or more is type B PHC. Okay, so I hope population norm and all the information which we give in these two sessions will be really helpful to you. If you read this two session well, you can do most of the question correct. Okay. Now, if you have any question you want to ask, please feel free to ask. Okay. Thank you so much, my dear friend, for this session. I hope you will rock the exam. Just two advice last before going, that on the last day, when you are going to take the exam, better is to take sleep, don't read things. But if you are reading something, read your strong subject on the last day. Second advice, in this day, don't keep watching your phone after 9 p.m. Try to close it so that you can have good sleep habit. And even if you don't sleep properly, don't give too much importance to sleep. Sleep is like your ex-boyfriend, ex-girlfriend. If you will give too much importance, it will get disturbed. So ignore your sleep. And even if you are unable to sleep, on the next day, take paracetamol tablet with omeprazole so that you don't have gas and body ache and you can focus better. And one of the second rank holder in NEET exam had said it personally to his psychiatrist doctor, my friend Ankur Jain sir, that I was able to score second rank in spite of not sleeping in the night. So if someone can get second rank in NEET in spite of not sleeping, we can easily clear the exam even if we are not sleeping. So don't give it much importance to sleeping and you will be able to sleep. Sleep. Don't forget to take your breakfast. Of course, you will pray because your ass is cracked, so prayer comes out naturally. And फटी पड़ी है तो याद तो करोगे ही ऊपर वाले को. लेकिन साथ में नाश्ता करना मत भूलना, गैस और पीसीएम की गोली ले लेना और चिल मार के एग्जाम फोड़ के आना. And do good in the exam, take PCM homage, and don't forget to take your breakfast. Okay. So love you all, my dear friend. My heartiest wishes is that you should have good exam. Love you all. Bye bye. Hasta la vista. Das vidania. Thank you so much. Thank you, my dear friend.